Colleagues, I am introducing House Bill 2948A. Like House Bill 2023 on hospital discharge that we passed last week, House Bill 2948 was brought to me by Jerry GABAY, who lost his only child to suicide at age 21, and Julie Majors, who testified with her daughter, who attempted suicide twice at age 16. As I mentioned last week, suicide is a major issue in our state. We have the second highest suicide rate in the country, and it is the leading cause of death among Oregonians aged 10 to 24. In 2011, Oregonians killed themselves at twice the number who died in vehicle crashes and 6 times the homicide rate. And the number of suicides has climbed since then. There are many challenges in filling the gaps of the fragmented mental health system. One of them is the fear that providers have in disclosing information to those closest to patients, when it is often critical to their care. Last week, our good colleague from the soul of Portland spoke passionately about his struggles to get sufficient information from providers about his wife upon her discharges from multiple hospitalization, about which she is very open now. During a mental health crisis, when there is often a huge need for coordination, HIPAA, which is often misunderstood, actually allows for communications in certain conditions. House Bill 2948 clarifies the federal HIPAA privacy rule regarding conditions under which protected health information may be disclosed by a healthcare provider without obtaining authorization from the individual. The Director of the Office of Civil Rights of the U.S. Department of Health and Human Services issued a clarification of the HIPAA privacy rule in January 2013, which is in OLAS, following the Sandy Hook and Aurora mass shootings. The Oregon DOJ and Legislative Council has also confirmed that House Bill 2948 is consistent with HIPAA and the privacy rule. The clarification enables continuity of care and clinically appropriate step-down treatments with engagement by family and friends as appropriate. We had compelling testimony in support of the bill from Jerry GABAY, a board member of the Oregon chapter of NAMI, the National Alliance on Mental Illness, and Julie Majors of the Multnomah County chapter of NAMI, and also of the Oregon Young Adult Suicide Prevention Steering Committee, as well as Julie's daughter and a number of families impacted by this tragic disease. It is also supported by the Oregon Alliance of Children's Programs and the Oregon College of Emergency Physicians. The bill passed unanimously with 9 votes in the Healthcare Committee, and I urge your aye vote.